Good morning, I'm Rosalie. Today our show will address how inflation is affecting our health care. So shop around because it's not that complicated. And when choosing a Medicare plan, be sure to look for the Center for Medicaid and Medicare Services for their star ratings. And for those who need a career refresh, there are free skills training initiatives that offer all ages an opportunity to increase your access to advance your cloud computing skills. All this when we return. Mentoring opens doors for students and job seekers with disabilities. Open the door to an all-inclusive workplace. Watch the upcoming episodes of Disability Mentoring and get involved in your community. Be a mentor. Inflation has gripped our nation's economy as the majority of Americans try to focus on tightening their cost of living without sacrificing quality. Most hard hit are our seniors living on fixed incomes. For those individuals 65 and over, as well as those living with disabilities, now is the annual opportunity to save money and receive quality health care by enrolling in a Medicare Advantage or prescription drug plan during the annual election period. There are a wide range of Medicare Advantage plans to meet the needs of Medicare-eligible individuals. But understanding where to start can be confusing and sometimes overwhelming. Catherine Field is here to help Medicare-eligible individuals navigate the annual election period and discuss what people with Medicare should consider as they evaluate resources and plan options. Catherine is the Senior Vice President, Northwest Division Leader Retail Segment at Humana. Good morning, Catherine.
Hi, thank you for having me.
Catherine, there's a short window of time in 2022 to evaluate a Medicare plan and choose your option. How long is the annual election period this year?
Well, it runs from October 15th to December 7th. So it may sound like December 7th is a long time away, but it is going to be right around the corner before we know it.
Catherine, what is the distinction from Medicare Advantage compared to original Medicare?
That is such a great question because they kind of sound the same, but they are quite different. Both are programs that provide health care coverage for those who are over the age of 65 or those who are disabled. Medicare Advantage are plans that are administered by private health insurance companies. Medicare Advantage plans are required to offer and cover everything that original Medicare does, but they offer three distinct differences. The first is they offer maximum out-of-pocket protection, which is really just another way of saying you know how much you will pay out of pocket for the entire year. And once you hit that max, you're not going to pay any more. The second is that it has predictable copays. So it's easy to understand how much you're going to pay when you go visit your primary care doctor or your specialist, versus with original Medicare, you pay 20% of whatever the service is. And so sometimes that's hard to know. And then finally, Medicare Advantage plans offer a lot of the extras that original Medicare doesn't. So things like dental, hearing, vision, transportation oftentimes. Many of these plans also cover your Part D or your drug benefit. So if you're on original Medicare, you would buy a separate Part D plan. With Medicare Advantage plans, often it's included. So I always think about it as you get a little more protection, a little more predictability, and a whole bunch of extras.
That's an excellent explanation, Catherine. But most people don't realize that the government plays a part in creating health care plans. The Center for Medicaid and Medicare Services, CMS, has a STARS rating system. Why are the CMS STARS ratings so important when evaluating different plan options?
Well, I think it is such a terrific program because it gives consumers a sense of the quality of the plan they're choosing. Not just do they like the benefits, but what will their experience be like with the plan? So this star rating, every plan is evaluated annually. We are super excited about the next year. 96% of our members will be in a 4-star or greater plan. So lots of high quality plans with Humana. So we do encourage folks, look at all the plan, the benefit offerings and how do they meet your needs, but don't ignore the star rating because that's going to tell you something about the experience you as a consumer will have when you choose a plan. So again, it's a great program and we're just super proud of our results.
What should be top of mind when choosing a Medicare Advantage plan?
Think about it in two big buckets. One is what are your costs and what are your coverage requirements? So when I think about cost is think about what did you spend your healthcare dollars on this year in 2022 and what are you going to spend on in 2023? Then think about coverage. Are your doctors, the hospitals that you go to routinely, are they in network for that plan? And how about your prescriptions? Are the drugs that you take regularly covered and where are they covered in that plan? So think about both cost and coverage around what are you going to use in the new year and make sure that plan meets your needs.
And more important, to make sure your doctor is on that plan, who has cared for you throughout the years. And the hospitals and the specialists that you're comfortable with are also on your Medicare Advantage provider network. And this is a huge consideration, right?
Well, I think you're exactly right, is networks change every year or can change every year with the health plan. So you want to make sure as you're doing this personal evaluation and checking the plan that you're considering, that you're either on today or you're considering for next year, that your doctor is in network, that we don't want people to have to keep changing their doctor. Your continuity of care is super important to your health. So make sure you use tools either on Medicare.gov or like at Humana.com or work with a local certified agent, because those are all ways to find out, is the plan you're on or the one you're considering going to cover the doctors and hospitals that are most convenient or closest to you or you've been using for years.
If a person's on a Medicare Advantage plan, do they have to re-enroll in a Medicare plan every year?
That is such a great question because sometimes there's confusion around, do you have to re-enroll? The short answer is no, but given that there's so many plan changes and network changes from year to year, I always recommend people do that needs assessment, spend some time evaluating what you want out of your plan, and is your existing plan really meeting your needs? But short answer is no, you do not need to re-enroll.
However, if you have healthcare changes, it's a must to reevaluate your plan, right?
100%. We all, as we age, our needs change. So we need a plan that fits our aging needs for sure.
All right, Catherine, share with us what makes Humana's Medicare Advantage plans unique.
Well, there's a lot of exciting changes this year for Humana plans. We spent a lot of time this last year talking to our consumers, listening to what they needed and what the highest priorities were. One of the things that came back routinely as a high priority was dental coverage. So we've made a fair number of changes in both the total allowances, what's covered, ease of use. In the Florida market, we've expanded our network greatly, so lots more dentists in the network. So really excited about the dental benefits we're offering. The second thing is we've made a lot of changes with regard to our prescription benefits, our RX coverage, both the tiers and what drugs are covered in each of the tiers. So pay attention to the RX benefits associated with the Humana plans. And finally, we have partnered with USAA, and all our plans are recommended by USAA. So we're really excited about that partnership and their endorsement of our plans.
Well, you touched on prescription drugs. So if you have added a prescription drug since last year, you need to check if that prescription drug is covered under your new plan or your existing plan.
And it is really, again, this is an area where it changes every year. And so tools like at Medicare.gov or Humana.com can help you identify what your out-of-pocket cost will be on drugs, or is there a mail order option for you? So lots of great tools to help, because it is the most used benefit on every health plan.
Catherine, tell us where to find more information.
One of the nice things on Humana.com is you can sign up to talk to a licensed professional agent. You can do it virtually, you can do it in person, because those are the folks who really understand this area and can help you make the right choice for yourself this next year.
Thank you so much, Catherine, for joining us to share important resources on Medicare Advantage plans.
Thank you so much.
Mentoring opens doors for students and job seekers with disabilities. Open the door to an all-inclusive workplace. Watch the upcoming episodes of Disability Mentoring and get involved in your community. Be a mentor.
Proactive prevention of disease is a function of both the primary care physician and the individual working together to ensure the individual stays healthy and has a good quality of life. Also, to identify the beginning of a disease, example, cancer, diabetes, heart disease. Early detection increases the chances of a complete cure or a maintenance program for the individual patient. To learn more on how to achieve a greater quality of health through preventive medicine, contact us at Infinity Healthcare Group in Broward at 954-586-8058. And please remember, January 1st is coming. You need to schedule your annual wellness exam. It is so important. It is the baseline of your health.
The next Medicare enrollment period, as we mentioned, is quickly approaching. As seniors face a wave of new challenges, including crushing inflation, higher cost of living, and impending Medicare changes that are upcoming with the Inflation Reduction Act. Our next guest will inform you there are 3 Medicare decisions to protect your health and money. Joining us is Ari Parker, one of the country's leading Medicare experts and author of an important book that helps older adults navigate Medicare and healthcare decisions. The book is entitled, It's Not That Complicated. Good morning, Ari.
Good morning. Thank you for having me.
All right, Ari, break down into bite-sized chunks to help our audience better understand how to avoid the costliest mistakes seniors make when choosing a Medicare plan.
The costliest mistake seniors make when choosing a plan, in my experience, and I've helped thousands of people enroll, is that they don't shop all plans.
So how can the wrong Medicare plan affect your health and your wealth?
This is your opportunity to shop across all your options for 2023. What people may not realize here, Rosalie, is that there are hundreds of insurance companies offering thousands of plans, and there's massive differences across each of these plans. When you're not on the right Medicare coverage, it'll cost a fortune and your health could suffer. I know this firsthand. My dad's Medicare decisions cost him his life. As a result, I started a company. The company's name is Chapter, and we've helped thousands of seniors avoid costly Medicare mistakes. I've taken these experiences and I've written a short book. It's Not That Complicated. You can find it on Amazon, and it'll help you navigate changes to Medicare.
Many seniors wonder, what impact will the Inflation Reduction Act have on Medicare recipients?
Absolutely. The Inflation Reduction Act passed Congress a few weeks ago, and the big change in the Inflation Reduction Act won't go into effect until 2 years from now, won't go into effect until 2025. That's 2 years away.
Ari, explain how will the next 2 years affect Medicare Advantage prescription drug plans?
So what that means for you for this year and for next year is that there's lots of savings to capture. What people may not appreciate is that not all prescriptions are covered equally across plans. The prescription name matters, whether it's a generic or a brand name. The dosage and frequency matter too. And finally, the pharmacy you like to go to affects the price as well. At Chapter, we help you search all your plan options, and we typically save our members $1,100 per year just by reviewing their prescriptions and making sure that they're on the optimal plan.
What are some common misconceptions about Medicare?
Yeah, the most common misconception I see is that your broker has your best interests at heart. Your broker may say that they work with many health insurance companies, but what that means to them is three. You know that there's hundreds of different health insurance companies offering thousands of Medicare plans, and you wouldn't go to just one car dealership to determine the price of a car. So don't leave a decision as important as your healthcare to a broker who doesn't shop every plan available to you. The company I started, Chapter, is the only one I'm aware of that searches all options and allows you to shop all plans. And we're an entirely free resource to you.
When you turn 64, be prepared to learn about Medicare supplements, Medicare Advantage, Part C, Part D, the prescription drug plans. There are so many choices. So being well informed is so important. Right, Harry?
Yes, absolutely. And we have two great resources here. The first is my book, It's Not That Complicated. You can find it on Amazon. You can also head to askchapter.org/Ari. The second is a free Medicare decision sheet to help you review your Medicare plan and to make sure that you're on the right coverage for 2023.
All right, what quick free resources can you offer our viewers to navigate these life-saving decisions right now?
Well, the other resource would be to call the Chapter team, and we'll give you one-on-one assistance with your Medicare. We've helped thousands of people sign up for Medicare and avoid costly mistakes. There's no charge to work with us. It's 100% free to you. If you have a pen handy, our number is 888-802-1674.
Thank you, Ari, for joining us and sharing tips on how to make the right Medicare decisions critical to protect your health and your wealth.
Thank you for having me.
Mentoring opens doors for students and job seekers with disabilities. Open the door to an all-inclusive workplace. Watch the upcoming episodes of Disability Mentoring and get involved in your community. Be a mentor.
Proactive prevention of disease is a function of both the primary care physician and the individual working together to ensure the individual stays healthy and has a good quality of life. Also, to identify the beginning of a disease, example, cancer, diabetes, heart disease. Early detection increases the chances of a complete cure or a maintenance program for the individual patient. To learn more on how to achieve a greater quality of health through preventive medicine, contact us at Infinity Healthcare Group in Broward at 954-586-8058. And please remember, January 1st is coming. You need to schedule your annual wellness exam. It is so important. It is the baseline of your health.
October is National Disability Employment Awareness Month, and it's celebrated by the U.S. Department of Labor Office of Disability Employment Policy. In September 2022, the Department of Labor found people with disabilities ages 16 years and over had 23.2% labor force participation rate versus 67.8% of people without disabilities. That's a huge disparity considering people with disabilities are the most underutilized labor pool in the United States. So, if you're looking to advance in a career or at your present job, ask yourself, are you ready for a career refresh? A new report by Gallup and Amazon Web Services found 98% of individuals who have taken digital skills training in the past year say their career has benefited from the training. Kevin Kelly, Director of Cloud Career Training Programs at Amazon Web Services Training and Certification, joins us to discuss the survey and free skills training initiatives to make cloud computing skills more accessible. Good morning, Kevin.
Good morning. Thank you for having me on.
How did the digital skills study come about?
Yeah, it came about because we're interested in helping learners connect with the cloud skills that they need to align with in-demand cloud roles. And the research by Gallup and AWS highlights the positive impact that digital skills training has on people, the companies they work for, and the communities that they live in. So people with digital skills, intermediate and advanced digital skills, earn a premium of 40 to 65% more than individuals without those basic digital skills. And so companies that use the cloud are innovating quickly, and you can get paid more if you have these in-demand digital skills. And so we believe in the power of skills training to positively impact people's lives. And that's why Amazon has invested hundreds of millions of dollars to provide free cloud computing skills training to 29 million people by 2025.
So share some of the key findings in this study that Amazon Web Services conducted with Gallup.
Yeah, there's a greater need and an increasing need for individuals with digital and cloud computing skills. And that's because lots of organizations all around us are using the cloud to create the kind of features and services that they offer. And these include companies like Disney Plus, Airbnb, Netflix, Lyft, and many others. And so we want to make it easy for people who are interested in learning about the cloud computing, and gaining the skills needed for entry-level and mid-level career roles in the cloud, that they can get access to those skills. We also think it's important that everyone become a little bit more cloud computing fluent, because we've seen individuals in marketing, finance, operations, logistics, and sales benefit from increasing their digital and cloud computing fluency.
So Kevin, what you're saying is digital skills are so in demand for all of us, even older workers?
Absolutely. You're never too young or too old to learn about the cloud.
Well, tell us about the free initiatives Amazon Web Services is offering to help people develop cloud computing skills.
Yeah, our programs are really designed to meet learners of all kinds, wherever they are, and whatever amount of cloud and IT experience that they have. So we have more than 500 free digital on-demand courses that are available through our AWS Skill Builder. We also have hundreds of hours of self-paced training and learning paths that includes interactive labs through AWS Educate. So really anyone with an internet connection can log in and start learning for free.
I understand Amazon Web Services, or as you refer to it, AWS, has a free program for those who are in war-torn country of Ukraine.
We've just announced a couple of new programs. One is IT Skills for You, and this is an initiative specifically designed to help Ukrainians around the world gain access to free cloud computing skills training and career support services localized into Ukrainian.
All right, tell us about Amazon Web Services Restart curriculum to help people launch careers in the cloud.
We also have a program called AWS Restart Associate, which is an expansion of our existing AWS Restart program. And this is to help under and unemployed individuals who are looking to modernize, upskill, refresh their IT skills, and pivot into entry and mid-level cloud careers.
What programs do you have for students who just graduated from high school or starting a state college?
Yeah, we have programs like AWS Educate that has the hundreds of hours of self-paced training and interactive labs. We also have a program called AWS Get IT, which is a program designed for young women, 12 to 14, to learn about IT and STEM careers. We have AWS Think Big Spaces, which is a place beyond the classroom for students and their teachers from elementary to high school to explore and cultivate and invest in IT and STEM career opportunities. And we have a program called AWS Academy, where we provide free, ready-to-teach cloud curriculum and labs to higher ed institutions so that learners in college and university can prepare for in-demand cloud roles.
Do most universities have these programs available, or do students have to find them and initiate enrolling in these programs themselves?
Yeah, we have over 5,000 AWS Academy member institutions. So learners can find out about the program by visiting our website at aboutamazon.com/29 million.
So, Kevin, anyone looking for higher paying jobs on the cloud can work remotely and benefit?
These are important programs that really align people of any starting level, whether they're in IT or new to the cloud, with some real exciting in-demand, good paying, oftentimes remote-enabled jobs. And we're excited for people to take advantage of these programs.
Wow. Working remotely can help millions of workers advance their career field. Fabulous.
Exactly.
Thanks so much, Kevin, for joining us and sharing this valuable free digital skills training information that offers free cloud computing training through Amazon Web Services. And it's designed to meet a variety of schedules that people may have and their learning goals.
Thank you for the opportunity.
Mentoring opens doors for students and job seekers with disabilities. Open the door to an all-inclusive workplace. Watch the upcoming episodes of Disability Mentoring and get involved in your community. Be a mentor.
Proactive prevention of disease is a function of both the primary care physician and the individual working together to ensure the individual stays healthy and has a good quality of life. Also, to identify the beginning of a disease, example, cancer, diabetes, heart disease. Early detection increases the chances of a complete cure or a maintenance program for the individual patient. To learn more on how to achieve a greater quality of health through preventive medicine, contact us at Infinity Healthcare Group in Broward at 954-586-8058. And please remember, January 1st is coming. You need to schedule your annual wellness exam. It is so important. It is the baseline of your health.
Healthcare plans for older Americans and people with disabilities is not complicated. It takes time to evaluate the best plans and the best options that will address your health and your wealth. Take this opportunity to refresh your career or advance your computing skills development at any age. Mostly those who are unemployed or underemployed, like people with disabilities, who represent 23.2% of our labor force. Share your health and your wealth concerns at facebook.com/Rose Lee Show. And follow us on Instagram at The Rose Lee Show. Watch this episode and many others 24/7 at RoseleeArcherShow.com. Thanks so much for joining us this morning, and we look forward to seeing you soon.